Hi everyone, this is Dr. Heather Austin Robillard again, and this lecture video is going to be over multidimensional instruments or measurements when using a substance abuse evaluation. To review from previous lectures, I just want to remind you that psychological tests and constructs do exist, and they do have the assumption that these constructs precipitate certain behaviors. They are informed specific concepts or constructed to describe and explain a specific behavior. They're obviously very varied. They can measure addiction, introversion, craving, and many others. And then, of course, traits are distinguishable, relatively enduring way in which one individual varies from another one. It does not need to be manifesting 100% of the time, and it can be situationally dependent. And then states are relatively less enduring and may happen only in situations. You've also seen this ASAM diagram that denotes the different dimensions of multidimensional assessment. Dimension 1 being acute intoxication, biomedical conditions, Dimension 3, emotional behavioral cognitive conditions, Dimension 4, readiness to change, Dimension 5, relapse continued use, and Dimension 6, recovery and living environment. You'll remember we've gone over a couple different dimensions with specific measurement tools. Well, in this video, we're going to talk about some of those multidimensional assessment tools that will cover all of the dimensions of ASAM. For example, if we take a look at the Los Angeles County assessment tool, which you have seen in some of the previous modules, you can see that some of the questions are specifically related to the dimensions. For example, here is the dimension for substance abuse in Dimension 1. And you can scroll down, and the assessment tool asks for the evaluator's severity rating for Dimension 1. And this goes on and so on throughout this assessment tool. Again, so we're really paying attention to the ASAM dimension specifically in this screening tool. So again, we are paying specific attention to the ASAM dimensions in this measurement tool. The measures and techniques that we have discussed so far are either those that evaluate only one thing, like the substance use disorder screeners like the CAGE, PTSD screeners, trauma screeners, motivation to change, withdrawal severities. And then those assessment tools that look at multiple things like the ASAM-based assessment instruments, or when you interviewed your individual clients in the role play video for writing exercise 1, where we looked at different domains. Specifically, this lecture video, I want to discuss those specific multidimensional tools that assess more than one domain in the tool. Why do we want to look at multiple domains? Well, one, substance use disorder impacts global functioning. It's hardly found just in itself. There are different domains that impact treatment and referral for treatment. And then thirdly, with mental illness, we need to have a whole person perspective and not just their symptoms. So this really helps with treatment planning and giving them the individualized treatment that covers these multiple domains of substance use disorder. The first multidimensional assessment tool that I want to look at is called the POSIT, the Problem-Oriented Screening Instrument, specifically for teenagers. The POSIT is a rather long assessment tool. It is 139 items. However, they are all yes or no, and it is specifically targeted for individuals that are 12 to 19. It is a paper and pen assessment tool, but you can also use it on the computer, and it takes about 20 to 30 minutes of administration time. They do have versions in both English and Spanish, and there is a manual, and it is free to use. The psychometrics are really good in that it is both valid and reliable. It is a multidimensional screening instrument as it screens for what areas need additional assessment. It screens for physical health, mental health, family relations, peer relations, educational status, vocational status, social skills, leisure and recreation, and aggressive or delinquent behavior. So let's take a look at the POSIT. The POSIT, as you can see, is just several different questions like, do you have so much energy you don't know what to do with it? And it's a yes or no answer. Some other questions include, do you scream a lot? Yes or no? And then when you go down to the Posit questionnaire answer sheet, this is where you're putting yes or no for what the client answers. You can highlight it, you can just write it in the box next to it, whatever works best for you. Then the Posit questionnaire scoring template is a little bit interesting. As you can see, there are rows with black out, which means that if they answered yes or no, whichever section is blacked out means that it does not get a score. So here's a better way to look at it. As you can see for question 1, the yes answer is highlighted. So if a client reported yes, you would add 1 point to their mental health and their educational status domain. If a client answered no in question 39, this would add 1 point to vocational status. And if the client is 16 years or older, then you would also give them a 1. Then you would add up all of the points for each of those domains, A through J, and that would give you some more information about whether they would need more referral treatment or assessment information for those specific domains. So as you can see for domain 1, all items are red flags. So if at any point they get any points for those specific questions, then that means additional assessments needed. Another example would be educational status. Their cutoff point is 6 points. So if in that domain, if they get at least 6 points or more, then more additional assessment is needed. The manual in Blackboard does provide some more information on how to score this assessment measure. But remember, it's important for your scope of practice whether you utilize this specific measurement or not. For example, if you're primarily working with adults, this wouldn't be an appropriate multidimensional assessment tool. Now let's take a look at the Addiction Severity Index, which might be one that you will utilize more if you become an LCDC. The ASI is a semi-structured interview. So you are asking the questions. This is not a self-report for your client to fill out. That's why training is recommended for utilizing this specific assessment tool. It is rather long in that it is 164 items, and it takes about 45 to 75 minutes with some follow-up questions and time. The adult version of the ASI does provide a substance abuse diagnosis, treatment, and research. The teen ASI is a little bit shorter with 111 items. It is a standard for clinical assessment in about 20 U.S. states as well as the VA, and it is translated into 20 languages. It is for public use and free, located on the website. Note that there is an ASI 6th version, but it is still being evaluated for its psychometrics, so we're still going to be using the ASI 5 for this course currently. Other important notes for the ASI is that it does require training and practice in order to be good at it. So we will be practicing utilizing the ASI in this course. Please read over the ASI manual and continue to practice in your role play with Activity 5, which is how to be good at an interview, which we learned in previous modules in this course. So the ASI goes over 7 domains that are similar to the domains in ASAM. The 7 domains are the alcohol use or other drug use, medical problems, psychiatric problems, employment, family relations, and illegal activity. The time frame and duration is looked at over the 30 days and over lifetime. It provides both a qualitative and quantitative ratings. It also allows for the clinician's input for need for treatment or other clinical impressions. So a little bit about the scoring or the ratings. There is 2 types of scoring. There's the patient's rating as well as the interviewer's severity rating. The patient's rating as to their idea of the severity of their problem and to the extent to which they feel treatment for them is important. This is important for treatment planning because it speaks to what the client is more inclined to address. Then in the interviewer severity rating, this is where the interviewer or evaluator sees a need for treatment where there currently is none, or for more additional formal type of treatment where the patient is currently receiving some form of treatment. So you can see the rating levels for each the client and for the interviewer or evaluator. So for the interviewer rating, you want to derive a range of scores, 2 to 3 points, which best describes the patient's need for treatment at the present time based on the objective data alone. Then you're going to select a point within the range above using only the subjective data in this section. There are some exceptions to this when cases for patients who obviously need treatment and reports no such need, for example, if they are having severe withdrawal ratings. In the domains, there is some general information or demographic information like date of admission, gender, race, date of birth, controlled environment, and additional test results like urinalysis or other screening tools. Then there is the medical status domain. This focuses on medical problems excluding psychiatric problems. Number of times that they were hospitalized for overdose or for detox, any chronic medical conditions, medication that they are taking, any disability that they're on, and then the patient's perceived severity and the interviewer's perceived severity. So in the assessment tool, the critical items to look for are the first question and the third question, which look at lifetime hospitalizations and chronic problems. Another domain is employment status. These are occupation and support questions like education, occupation history, patterns of employment, tools in order to get a job, like do they have a driver's license or a visa. Other sources of support, like are they getting disability or child support. Then we ask the patient's perceived problem severity as well as the clinician's confidence rating. Clinical items to be aware of in this section are questions 1 and 2, 3, 6, and 10. Another domain, obviously, is the alcohol and drug use domains. These are looking at the type of drug abuse and the severity rating, treatment history and times of abstinence, patient's perceived severity of the problem, as well as the clinician's confidence rating. Critical items in this section are questions 1 through 13, 15 and 16, 17 and 18, and 19 and 20. In this domain, they look over the past 30 days. For example, how many days in the past 30 have you used drugs or alcohol? And also lifetime, how many years of your life have you been regularly using alcohol? And by regularly, I mean 3 or more times a week. Another domain is legal status. Present legal status, crimes arrested or charged for, DUIs, incarceration history, patient's perceived severity of this, as well as the clinician's confidence rating. Critical items in this stage are L3 through 6, 17, 24, and 27. Another domain is the family and social relationships. Family has history of substance abuse as well as psychiatric problems, marital status and living arrangements, relationship satisfaction, relationships close to significant problems with the person, history of emotional, physical, or sexual abuse, patient's perceived severity of these issues, as well as the clinician's confidence rating. The critical items in this section include questions 2, 3, 5, 6, 10, 30 and 31, and 18 through 26. The domain of psychiatric status is kind of looking at the broad symptomology of their mental health: depression, suicide attempts, hallucinations, any treatment history for their mental health, clinical impressions of the interviewer, patient's perceived severity of these issues, as well as the clinician's confidence rating. Critical items for this one include the question 1 and 3 through 10. And again, when it comes to scoring, the information provided for qualitative is going to be like those demographic questions, as well as the types of drug abused and their family history. And then quantitative is going to be those interviewers' severity rating, the patient's rating, and then the composite scores of all those domains. So with the clinician's severity rating, If you score your client on a specific domain as 0 to 1, then you are determining that there's not really a problem and treatment is not indicated. If there is a score of 2 to 3, there's a slight problem and treatment is probably needed. 4 to 5 is a moderate problem and some treatment is indicated. 6 to 7 is considerable problem and treatment is necessary. And 8 to 9 is extreme problem where treatment is absolutely necessary. You will see on the assessment tool this severity profile. For each domain, you are marking where you are, and it gives you a little graph on your severity profile for the client. Overall, the psychometrics for ASI and the recommendations are that the problematic psychometric properties is that it might be heterogeneity where it's focused on the majority of the population. However, the practical use is recommended because it summarizes the overall status, the bigger picture, rather than specific domains. And information on other life situations is pertinent to treatment. So it provides a general prognosis for the client.